Hey, my name is Chloe. I'm from the Midwife Is In, and today my video is going to be about how to tell if you're pregnant. The first step here is to even wonder if maybe you're pregnant. And why would you wonder that? Maybe you are missing your period. You look in your bathroom and you look at your box of tampons and you think, wow, I haven't had to buy a box of tampons in ages. Other things that you could notice are that your boobs are feeling achy, sore, your chest, even up here, up in the armpit area is feeling achy and sore, tender. Maybe you're feeling nauseous, maybe you're vomiting. Sometimes people get really lightheaded, so when they stand up, they suddenly get lightheaded, things get dark from the outside. Sometimes people just feel off or feel pregnant. That can happen. Some people come in and say, I just knew it. I just knew I felt pregnant. Whatever that is for you, if you think that you're pregnant, you should take a pregnancy test. So how do you take the test? You look at the box. Every single one of them is going to be different. Some of them have sticks that you have to pee onto. Some of them you have to pee into a cup and then dip the stick into the cup. Really follow the instructions to a T. Incorrect usage, that gives you incorrect response. Buy anything. Buy the cheapest one there. All of them work. Don't have to worry about having to buy the most expensive one. And I always suggest buying more than one. First of all, so that you have them on hand just in case you're worried at home. But second of all, if you get a negative, you can wait a week and test again. It works by testing for a specific hormone called human chorionic gonadotropin, which is a hormone that is only released by the cells that will eventually become the placenta if you decide to carry that pregnancy to term. The hormone is released in very small levels at the first moment of pregnancy, but it quickly gets higher and higher and higher and higher. The pregnancy tests that we use test for a specific level of that hormone in your urine. It's either a yes, it's above 25 milliunits, or no, it's not above 25 milliunits. So you know that a positive is almost always a true positive. Once you know that you're pregnant, you have a few options. Your first option is to decide if you would like to carry that pregnancy to term or not. If you would not like to carry the pregnancy to term, you can have an abortion. Depending on how pregnant you are, when you decide that you want to have an abortion, you can do abortion in two different ways. If you're fewer than 9 weeks pregnant, you can take a pill in the clinic with your provider, then go home, take 2 more pills, and have what amounts to a pretty heavy, crampy period. During that period, you'll pass the products of conception. Your other option is to stay in the clinic to have what's called a surgical abortion procedure. It sounds a lot scarier than it is because there's no actual surgery, nothing's getting cut open. What happens is that they will provide you with some form of pain medication, whether it's just local, whether it's enough to make you sleepy and non-anxious, or whether it's enough to actually put you to sleep. And then they will use a soft plastic tube to vacuum the contents of your uterus out. Abortion is a safe procedure. It is far safer than pregnancy, and it has no bearing on your future fertility. It will not stop you from getting pregnant in the future. Your other option then is to decide to carry to term. And once you give birth, 2 options again. You can decide to place the baby for adoption with an adoption agency or a known adoptive family, or you can decide to parent the baby. No matter what you decide, as soon as you know you're pregnant, you should call a healthcare provider to get some follow-up, make sure everything's healthy and good, and get set up with the type of care that you would like.